Hi, I'm Scott from San Jose, California. It's a beautiful day outside, and when that happens, people want to get out and be active, which is great. That's what we need to do. But what is the one joint or set of muscles that always reacts to the world around us, no matter what we do? And then based off of how those muscles or that joint reacts, the rest of the body has to adapt to it. Well, it's your feet. The feet are some of the most important joints in your entire body. However your feet land or however your feet push off will dictate how the rest of your body moves. So if the feet aren't landing properly or pushing off properly, well then that can cause some compensations in the rest of the body, causing you to have stress in your back, shoulder, neck, hip, knee, wherever. Okay, so in today's video, we're going to go over all the muscles that are associated with the foot and the ankle, the joint itself, and then we're going to go over exercises that will help provide stability in the ankles and the feet. All right. Unfortunately, 98% of all people have unstable feet, so I know there's a lot of people out there that need this help. So without further ado, let's get to the body.
Okay, so here we are looking at the lower leg and foot. Check this out. Look at all these different individual muscles. Okay, these are all in the lower leg muscle, but notice, okay, so this is the calcaneus, all right, which is your heel, okay, then here is the fibula, all right, and then inside there, right there is the talus. So that's what your lower leg connects into, and then that's what connects to the calcaneus. And that's what makes up your ankle joint right here. So all these muscles here that connect into either the heel, the calcaneus, or crosses that ankle, which these muscles cross the ankle joint, okay, technically. And then all these muscles that cross the ankle joint, you see this white tissue? Okay, all that white tissue that's crossing, those are tendons. Okay, these are all tendons, which goes from muscles to attach to bones. All right, that's that attachment points there. All right. So any of these muscles that cross the ankle joint has the ability to move and stabilize the ankle. So all of these muscles have the ability to either help or not help, depending upon what's going on with the foot. And then also notice these muscles here, that these tendons that attach to the toe, look at that, it crosses the ankle joint. Okay, so you have muscles that attach all the way up the leg, attached to the tip of your toes here. Let's see if I can get this one there, right there also, to the tip of these toes. And then same thing here. Yeah, lucius longus. Can you see? It attaches right there. Okay, so even on the bottom side, there are muscles that attach to the tip of the toes and goes all the way up crossing the ankle. So it's really important that you stabilize this lower leg in order to help stabilize this foot. Okay, so we're going to dive in deep and remove all the layers so you can see how the structure, okay, the structure is really important because structure dictates what the muscles can do. So everything is based off of whatever the structure is permitting you to be able to do. So what that means is if you have, see this is the calcaneus. If you have a really, this is an average size calcaneus, which gives you an average size arch. The arch of your foot is dictated by the size of your calcaneus, okay? If you have a larger calcaneus, then you're going to have a larger arch. If you have a smaller calcaneus, well, then you're going to have a smaller arch. That's how come people were born with flat feet. Okay, that flat foot thing is just because of the size of of your heel, of your calcaneus. A high arch person that was born that way has a larger heel, and that's just relative to your foot. Okay, but anyone can develop flat feet, and anyone can develop high arches, depending upon how their body reacts to the stresses that is being put onto the leg. If it's quite possible for the foot to have so much stress in a way where it loses the ability to supinate or to create an arch. Okay, so it goes into a shock absorbing, state, a pronated state. That's when your foot comes flattened and your toes are rotated more out, away from the midline of the body. So if you used to have your feet kind of like in a little bit more, but now as you've gotten older, your feet are rotating out. Well, that's a pronated position, and that happens because enough stress has gone through the body and the foot has lost the ability to supinate properly. Okay, there's nothing wrong with going into an extreme pronation or extreme supination as long as you're not stuck in that position. If you're stuck in one of those positions, there's the problem. Okay, and the whole point, what we should have is symmetry. Okay, so let's go back into the muscles, and then what we're going to do is we're going to go over all the exercises that you can perform, and I'm going to show you here with these muscles what you should be focusing and feeling when you're trying to do these exercises. Now, again, this is going to be a general workout plan. It's not going to be specific to you and your needs. If you're interested in getting some work done that's specific to you and your needs, I offer a personalized assessment and corrective exercise program for $50. Everything is done remotely with a HIPAA compliant app, so all your personal information is completely protected. We take pictures, we do video, I assess everything, you get instructions on how to do all of this, and I will assess it, and then I will report back an exercise prescription specifically to meet your needs to help your specific issue. Okay? So without further ado, let's get to the exercises that are generally going to be the ones that are going to help out. Okay, so here are 6 exercises to help improve the stability of the feet. All right, all these different exercises are to be done different times of the day, the week. This one at the very bottom that we're going to go over, this one should be done daily. That's like there's only one set that you're going to be doing. Okay, and it's just a gentle calf stretch, but we're going to talk about specific ways of how to do that to make sure you're doing it right. Okay, so the first one, towel crunches. Okay, a lot of people have probably done this before. This is a really great exercise to really strengthen the muscles that attach on the bottom of your foot and even come up to the back of your calf. Okay, so for best results, you want to be in a seated position and kind of try to make it so that you're not using anything above your knee. Now, if you look back at the image that I have of the body, check it out. You see how we have certain muscles, all these white tissue is tendons, okay? So see how we have all these muscles above the knee, but they connect on the lower body, okay, the lower leg, all right? All those muscles that do that have the ability to help influence the lower leg. So if you don't have the ability to use these particular muscles very well, specifically here, these toe flexors, okay, which attach right here in the back of your calf and everything underneath your big gastroc. That's just your big gastroc right there, okay? That's the big calf muscle that everyone knows and sees. Okay, that's the soleus. It's a little bit bigger, but it's a deep one right there in those toes. And those are the ones we're going to start with, okay? So that's for the big toe. Let's see. Try to get it. Yep. Digitorum longus. Yep. Remove some layers. Oops, too many. There. So digitorum longus, it goes up here as well. So all those toe muscles cross the ankle joint. All right. But anyway, any of the muscles that have the ability to attach to this leg from above has the ability to try to mimic and pull on these muscles to try to cause the foot to move, okay? That's how our body compensates. That's just how it's designed, Okay, so even though in this image it shows that it's not really attaching to the same spot, they're attaching to the same spot. They overlap and everything. So this muscle right here, bicep femoris, is a hamstring muscle. It connects in the same place as your peroneus longus muscles, your soleus muscles. It connects to the same place as the anterior tibialis, to the extensor digitorum longus. So this muscle right here, since it attaches in the same general area, has the ability to try to influence these muscles. Okay, so it's really important that when you're doing these exercises that you're seated and you're doing everything you can to not let anything above the knee do any of the work. Okay, so let's go back and check this out. All right, so again, seated in a chair, then just using a towel. And all you're doing is scrunching up. You really want to try and focus very slow and control, gripping and squeezing. Kind of like if you have your hand into a bucket of sand or at the beach and you put your hands deep into the sand and you kind of like squeeze the sand out of your hands. Same kind of thing. You want to think about trying to squeeze the towel and bunch it all up with those toes. Okay, then just relax and re-grasp it again. Okay, let's watch a video and see how that's done. Perfect. Extending out, that's really good. That person has crazy toe strength and stability. You're not going to have it at the very beginning when you start doing this, but that's very strong toes and feet. That's the goal. Okay, but don't worry about not having that in the very beginning. Do your best and just really concentrate and focus, not using anything above that knee, just using all the muscles around the lower leg into the toes. Okay? So let's go back. All right. Okay, so dorsiflexion. So that has to do primarily, losing everything. Okay, with the anterior tibialis is what it's called. Okay, that's the primary muscle that helps with that. Let's see, your extensor digitorum longus is going to help with that also. And then your peroneus tertius is going to help out with that as well. Okay, so if you look at it, let's see if we can get it over here. So this is the main muscle. Now check it out. It attaches right here. Here's your tibia, that big, huge shin bone that we all have, okay? It attaches right here on the outside portion, connects on top of it, and then the ligament comes down right there and attaches right here on the side, and actually kind of attaches, I'm going to lose it in order to show you, attaches like right underneath here. Okay, that's where it attaches. So don't be surprised when you're doing this exercise. If your big toe kind of rotates out this direction to the outside, that would be normal. Okay, it doesn't mean that if it doesn't rotate out that you're doing it wrong. I'm just saying that don't be surprised if that happens. As long as you're feeling this big, huge, meaty muscle doing most of the work, then you're doing it right. Okay, so let's go back and check out that exercise. So the person is seated down here. If you have the ability to sit down like this on a flat surface, that's ideal and that's great. But if you can't, that's okay. You want to be in a position where your knee can be straight. So you can be in a seated position, so sitting on the chair again, and then just scoot forward in a position where your leg is hanging off and the knee is straight. And then all you're going to be focusing on doing is just trying to flex or extend this ankle. Okay, it's really easy to get the quad engaged on this because, again, let's see that quad muscle? It attaches. This is the attachment. It comes here and it connects the entire quad. All this muscle, diagram's not doing a great job showing it, but it comes in and they all connect right here, and feed into this spot right here. And because it crosses that knee joint, that's how it's able to extend your knee, because it crosses that knee joint. and it connects right next to where this muscle connects to, it's possible for your body to try to compensate and try to pull on this to try to tug on this. It does it very poorly, but it'll try to do it. Okay, so really try to relax that quad. Try not to let it get involved at all if you can. If you're feeling this working, then it's too involved. All right, no matter what, it will contract 15% of strength, but that shouldn't be enough for you to actually feel it. What you should be feeling are all these muscles right in here. Okay, right there. Okay, so let's go back and look at it, and let's check out that video to see how it's performed. Nice and gentle, pulling. Now notice how the toes aren't really getting extended or anything that violently. Okay, they're going to be working a little bit, but the main focus is, again, this main big muscle here, okay, which connects on the inside of that foot. Let's see that again. So one way that you can try to hack it, okay, this little shortcut, is thinking more about the heel, okay, that calcaneus. You see, as the foot is being flexed and the toes are coming up towards the knee, the heel is being pushed away. So it can be easier to think about trying to push your heel away from you to cause that same motion. And by doing that, that's going to focus more on the muscles above the ankle. Okay? So that's just a little tip from you to me. All right, let's go back to the next exercise. Eversion. All right, so this one are all the peroneus muscles mostly. You are going to hit some other extensor muscles with the toes and everything. Again, seated position, you're going to try to keep everything above the knee out of it. So really focusing on not using the knee, really focusing on just using this ankle. Okay, the ankle is the key. That's the big part that we're working on right now on this exercise. And really thinking about these outside, okay, outside of the fibula, the lower leg bone here. Those are the ones that we want to be mostly working with. Okay, you will feel some stuff on the bottom of your foot and on the toes and everything, but these are the main muscles that we're looking at. Okay, and all you're going to do is very simple. Don't think about trying to lift it up. Just think about trying to rotate the leg up. And what's going to end up happening is the big toe will flex down and the little toes will lift up. Okay, so don't really consciously think about having to twist your foot that way. Just think about trying to rotate your ankle, trying to rotate the ankle, bringing the foot across as best you can. And if everything is functioning like how it should, then the big toe will go down and these little digits, toes, the smaller toes, they'll come up. All right, this is a little bit of an excessive movement description here. Okay, let's go check out those muscles real quick. Okay. Oops. So that's the extensor digitorum longus. Those are toes muscles. You see how it's on this outside part. Okay. You see how it's going to flex and bring it up a little bit. Okay. So that's that attachment. These muscles get shorter, and so they help with that movement. All right. Then peroneus longus. Okay. That is the main muscle that's going to be associated with this movement. Attaches right here, crosses that ankle joint, pulls it across the body. This is peroneus brevis, okay? And then peroneus tertius. It will help out as well. Now the big toe will go down because flexor hallucis longus is going to be involved because it crosses. It goes across, and you see how it crosses on the outside here? When it shortens, it can help pull that foot to the outside like that, okay? And so that's what causes it to push down, all right? So now, let's go back, and let's see that exercise in motion. So don't think about having to consciously lift the foot up. That's what happens when the tertius muscle is getting activated a lot. And you see how the heel just slid out there a little bit? All right, that's inappropriate. That means they're using the hip a little too much. You see how the knee is caving in? That's not the best diagram right there, okay? So it looks like the person is consciously trying to push it in there, and they're using the muscles above the knee. So that's not what you want it to look like. You want the foot to be relaxed more on the floor and twisting it out. Sorry that this is a poor example, but this is the best one I could find, all right? Okay, now we're gonna look at ankle inversion, okay? This is exactly the same type of movement, just going the other direction, all right? So going into the midline of the body, inside the midpoint of your body. So everything is exactly the same when it comes to the exercise. Again, trying to prevent your anything above the knee from working. It's gonna be really easy for you to try to use the thigh, the groin, the hip to try to help out with this. Really wanna try and focus on these deep calf muscles on the, this is a better spot, inside part here, and attaches right through in the arch of the foot, okay? These are the muscles that work primarily with creating your arch. Let's check this out. Let's see if I can get you a good image here. Nope. Nope. Posterior tibialis, there it is. Yep. Okay, so posterior tibialis is the main muscle right there that's going to be involved with doing this. Now you see how it attaches and it's on this inside and it comes down and across right there. So when it flexes and shortens, it'll pull that foot up, okay? That's the beginning phase of supination, to create the arch of your foot. That muscle has to function properly in order to create the arch of your foot, all right? So that's the main muscle that you're going to be working with. Now there's going to be a lot of, oops, wrong way. There's going to be a lot of different other muscles. So gluteus longus, that's going to, it's not going to be involved that much, but it will help a little bit. Let's see. Soleus is going to do a little bit, but not very much. Gastroc will do a little bit. Plantaris, it'll do, it's not that much. The other one that's going to help out a lot is actually the flexor digitorum longus. You notice the the toes are going to come down and come across. And then what's actually going to help out a little bit more when it comes to the big toe is, oops, that's the bone, extensor hallucis longus, okay? Because it's on this side of the axis, and when you rotate, it will shorten and kind of pull that toe up. But again, don't think about the toes or anything. Think more about the ankle and just actually trying to rotate that foot across the body. So let's check out that video and see how it looks. Yeah. So again, same kind of thing here. Don't think about trying to swing it up. Think more about trying to swing it across the floor. Okay? All right. Now we're going to go to something very simple, but people screw this one up all the time. Okay, heel raises. Okay, on a flat surface. That's how you want to start things. Okay, just on a flat surface. You don't want to be on a step or an elevated surface where your feet can drop below the neutral position, because the reality is 98% of all people have unstable feet. In other words, 98% of people, this is actually beyond what their feet can actually handle, all right, because of the shoes that we use, right? Our shoes aren't very great at allowing our feet to be stable and strong. They do a lot of the support, and that's what causes them to become weaker. And then if you wear heels a lot or elevated heels, well, then being flat on the surface right here, that's going to violate your normal neutral position. So that's already a stressful position. So always start on the floor at the most extreme when you're doing footwork, trying to make it more stable. Now, where people kind of screw things up is a lot of times they overreact and use these toes way too much, these toe muscles, okay? The main muscle that's involved with these now they're called heel raises, right? So it's these calf muscles that connect directly to the heel that are supposed to shorten to lift the heel up. But again, these toe muscles that flex, that point down, they cross that ankle joint also, and they do a lot of work. Okay, they can do a lot of the work there. Now, having strong toe muscles like that is really good because that's a big part of stabilizing your feet and preventing you from falling forward. But with this particular exercise, see, that was what the toe towel crunching, that's what that was for. But with this one, the goal is more of this gastroc and soleus muscles, okay? And they cross and just attach the heel, the calcaneus. So what I recommend doing is making sure that all the toes are down, making sure that the ball of your foot is even, but your focus is actually trying to lift the heel up and then pushing the heel down to come down. All right, let's look at that muscle. Let me move it around. Oops. Okay, twist it around, Scott. Now I'm blocking it. Okay. So right here, this is the gastrocnemius, lateral, so outside's lateral, medial, those are the two heads. Attaches right here into the calcaneus, okay? And then, let's see, right here, the soleus, it attaches to the calcaneus as well. These are the primary muscles, okay, that will lift the heel up and let it come down, all right? So it shortens to pull it up, it lengthens to bring it down. All right, so you want to focus on this muscle just lifting the heel up and controlling it going back down. All right, let's check out the video. Watch them do it. Nice and controlled. Okay, you can use a chair, you can use a wall, whatever it is. That's really important. You come up, notice at the very top, tippity top, hold it for a couple seconds. 1, 2, and then control it down. Don't let gravity win, all right? Gravity is creating resistance to bring you up. You need to give gravity resistance to bring it back down. So you want to strengthen both the concentric, which is the shortening when you're going up, and then the eccentric, which is the lengthening phase of the muscle, okay? They're both vital in creating good stability, and you want to do that with every exercise we talked about. Sorry it took me till now to talk about that. Okay, here comes your daily exercise. Very simple. This is where we're going to try to practice in getting your feet the ability to go beyond that level floor neutral position and doing a stretch. Okay, now you want to consciously, slowly bring your heels down. Okay, so you're not going to just let gravity win and just give up like control and let gravity pull it down completely. You want to think about being in there and then just flexing, pushing those heels down to cause that lengthening in the back of the calves, which will then also cause a bunch of these muscles here in the front to contract and to give support, okay? The reason why you want to do it like that is because that's how the law of movement with our body works. In order for one muscle to lengthen, another muscle has to shorten, okay? In order for me to bend my elbow, certain muscles on this side of the elbow have to shorten, and then on the opposite side, they lengthen, all right? So when I'm trying to work on trying to lengthen this, if I'm not consciously trying to create shortening in the opposite side, well, this won't stay longer, okay? Because I'm not training the opposite side to work together like it's supposed to. That's just how it works. So whenever you're focusing and all you're doing is trying to focus on lengthening and you're not focusing on shortening on the opposite side, that's how come you have to constantly stretch and do it over and over and over again. So it's really important that you think about flexing this side of the muscles to cause this to lengthen better. And then that will make your stretching last longer and be better for you. Okay, let's check out the video, see how it works. So pushing down, gently coming back up, and then pushing back down. So not all the way up, just slightly back up to the neutral position and pushing down. Okay? Sorry. Go back. And that is it. So again, these first 5 exercises right here, the towel crunch, the dorsiflex, the eversion, the inversion, and then the heel raises, those are to be done 3 times a week. okay? There's no reason to do it more than that. If any of these cause discomfort or anything, might need to take a step back. In that case, I would definitely highly recommend getting an assessment done by me, and we can get you started on the right progression. The stretching one right here, do this daily, all right? Now, when it comes to the order, so when you're doing all these exercises together on the same day, you're going to want to do these exercises first. This is the order of progression that I want you to go in, and then the stretching part last. Obviously, on the daily exercises, when you're not doing this, you're just doing the stretches, okay? And only one time a day, 3 repetitions for 30 seconds, all right? Perfect.
All right, that's it. Thank you very much for making it to the very end. I really appreciate you taking the time to learn from me about how the foot functions and the step-by-step process on how you can start increasing stability back into your feet again so you can have more of an active lifestyle. Now stay tuned, because this is the exercise that you need to do for the next 4 weeks. After that, we're going to give you a new set of exercises to start working on to help progressing your body. Again, if you want to find what's the best way to improve your foot stability because of how you use your body and what might have happened to you, click the link in the description to get a personalized assessment and treatment plan done by me. Thanks a lot. I look forward to talking again soon.